Hoima, Bulisa, Nakasongola, Namayingo, Napak, Mayuge, Nakapiripirit, and Silonko have joined the list of districts with poor sanitation behavior.
So we are getting more and more bad districts. You know which family you're going to, huh?
The Health Ministry has now identified more 80 districts, bringing a total to 38 districts where this practice is rampant.
Practicing the popular ODF, open defecation.
This week, health officials summoned leaders from the 8 districts to Hoima to start the campaign against the practice, which has serious environmental and health implications.
Among these 8 new districts are prone to cholera outbreaks.
Most of these sanitation-related diseases are preventable. And if people are still suffering from preventable diseases, now that was a big challenge to government. So the Uganda Sanitation Fund comes in to fill this gap, to ensure that people no longer defecate in the open, and also to ensure that people actually appreciate the beauty of having latrines and defecating in the latrines, and also them appreciating the dangers of open defecation.
The officials say that open defecation and not washing one's hands after using the toilet is a community problem that requires a community solution.
It is now you, the community, who reinforce that one person or better who is failing you.
Everything we do, it is the communities that are taking lead. For us, we come in to give technical backstopping and financial assistance.
How do we eliminate feces reaching somebody's mouth? By having a store for feces. Washing hands, then having the mind changed of that person.
Bringing these best operating practices to ensure that they are also taken to scale. Other districts can also learn from Uganda Sanitation Fund program and also go and implement these best operating practices and help the communities and ensure that communities live in open defecation-free environments.
Only 27% of the people wash their hands with water and soap after visiting the toilet.
We empower communities and let them take charge of their sanitation improvement. It enables them to understand that open fecal defecation is a community problem.
Statistics on sanitation indicate that only 79% of Ugandans have latrines and toilets. As of 2015, the latrine coverage in Nakapiripirit stood at 23% and only 10% wash their hands after visiting a latrine. Also in Napak district in Karamoja sub-region, only 13% had latrines and 5.5% wash their hands after visiting a latrine. In Namayingo in Busoga sub-region, 48% had latrines, while only 28.7% cleaned their hands after using a toilet. Mayuga district had 67%, with latrines, only 24.4% washed their hands. 67% of the households in Silonko district had latrines, and only 31% washed their hands after the toilet. In Nakasongola district in Uganda region, the latrine coverage stood at 67%, with only 27.6% who think about washing their hands after visiting a latrine. In Hoima and Bulisa districts, the latrine coverage was at 68%, and only 22% washed their hands after going to a toilet.
That they had very low latrine coverage and poor hand washing coverage.
There is no way a child can leave the facility when it is still open like this because it covers the door. So the child will be forced to put it back, then the door will open and the child will go out.
World Health Organization reports indicate that Uganda spends over $380 million, which is approximately 1.8 trillion Uganda shillings, on treating diseases that are sanitation related and diseases that can be prevented with good hygiene practices.
When you look at national water, how much do we spend? But what do they treat actually? They are really fecal, coliform, bacteria and a few things. But all that because our sanitation is what? Poor.
To a number of health facilities, people who go there with cholera, people who go there with diarrhea, people who go there with stomach pains. Most of these diseases really are sanitation related and therefore preventable. it helps even the strain that people put on these health facilities. You will not find health facilities flooded by patients.
Otherwise, with a sick population, expect less productivity because all the time you are spending and people are not working.
In the 30 districts where the program was first piloted, progress has been registered with 94% of latrine coverage and hand washing. The health minister says, though people have a right to defecate, it should not be done openly.
What you call human rights, whose right? That you defecate here and infect your neighbor, and you call that one a right? I think we should redefine what human rights mean.
In order to implement the sanitation program in the 80 districts for the next 3 years, the ministry has received funding from the Global Sanitation Fund of the World Health Organization. Jingo Francis, NTV Weekend Edition.